question of the day this week. Our question says, the nurse is assessing a client who is experiencing an acute exacerbation of asthma. Which of the following findings would require immediate follow-up? So notice that word immediate is bolded. So we are looking for the most severe situation here, the most severe finding, the most dangerous thing. What do we need to immediately report to the healthcare provider or intervene for? Okay. So we have a client experiencing an asthma attack. So typically when a client experiences this, we want to give steroids to reduce lung inflammation, position them upright, nebulized albuterol, oxygen, those kind of things. So let's think about that kind of as we go through these options. Option 1, the finding of abrupt discontinuation of wheezing. This is going to be our correct answer because this requires immediate follow-up. This is an ominous sign. We call this silent chest, and it is when a client has been wheezing and then all of a sudden they stop. Okay. And what that kind of indicates is we're not moving any air. We are going to be in severe respiratory distress. We may need intubation. This is an emergency that we need to immediately follow up on, okay? But let's look at our other options. And option 2 says use of accessory muscles. This is concerning, right? It shows that we have an increased work of breathing. We're trying physically harder to get more air in and out. We would want to follow up, maybe give some albuterol or whatnot, but not a higher priority than option 1. And then option 3, it says a non-productive cough. This maybe some clients' only symptom of an asthma attack. It can happen because of bronchospasm. Obviously if they're coughing, we do want to notice that and follow up on it, but not a higher priority than option 1 again. And then option 4 is difficulty speaking. This indicates obviously some respiratory distress, right? We're short of breath. We can't get our words out. We definitely want to follow up. We may need some O2 administration, but again, not as high of a priority as option 1. So our question says, the nurse is observing a staff member caring for a client with chronic obstructive pulmonary disease or COPD. The nurse should intervene if the staff member is observed doing what? So we are looking for an action that we don't want to be done. Something, if we saw someone else doing it, we should stop, okay? Option 1 says demonstrating pursed lip breathing for the client. This is not a correct option because this is something we want our clients with COPD to do. Okay, pursed lip breathing really helps prolong exhalation for these clients, which helps with air trapping that they may experience. So it's a really good technique that these clients can use at home, at work, whenever really. So we definitely want to encourage them to use that. Option 2 says providing the client with information about smoking cessation. This is an incorrect option because it is something we want to do. So smoking really heavily contributes to development of COPD and also worsening of COPD. So we definitely need to encourage them to stop smoking. We can encourage use of gum or patches, those kind of things, but we really want to avoid smoking to prevent worsening of the condition, okay? Option 3 says administering albuterol to the client before meals. This is an incorrect option because it doesn't require intervention. Giving albuterol to clients with COPD before they eat can just help relieve their shortness of breath. It helps them conserve energy a little bit. These clients really have low reservoirs, if you will. It doesn't take much activity to really wear them out. So anything we can do to kind of help increase that tolerance will be great. And then option 4 says hyperoxygenating the client before assisting the client to ambulate. This would require intervention because it's something we don't want to do. So this makes it our correct answer. Clients with COPD function with a little bit lower of an SpO2 than normal. So when we give high concentrations of oxygen or we hyperoxygenate these clients, we can actually cause carbon dioxide retention, which can cause other problems. So we definitely want to avoid that. We want to administer the lowest concentration and amount of oxygen possible to get our desired effect, whatever our prescribed, ordered SpO2 goal is. So we definitely want to be very wary of over hyperoxygenating these clients. So we'll see you tomorrow for another question.